Hi, I'm Deb Flashenberg. I'm the founder and director of the Prenatal Yoga Center. I'm also a labor support doula and a Lamaze teacher and a mother of two. So what I thought I would talk about today is one of my favorite topics to talk about with our new students at the studio at Prenatal Yoga Center. It is 5 questions to talk to your care provider before your birth. So let's go ahead and kind of jump right in. So the first thing when you're checking out different care providers that you may want to have attending your birth, you want to find out their birth philosophy. So are they the medical model of birth or the midwifery model of birth? So let's talk about what the difference between those two are. So the medical model, it's more of a pathological potential. So they're looking at the situation and trying to solve problems before they actually erupt. So they're thinking this may happen, so therefore let's try this. For an example, the woman may be dehydrated or her blood sugar may drop. So now we're going to try to have full-time IV fluid. So that's just an example. So the opposite side of that is the midwifery model of care. And what that is, it's looking at birth, pregnancy, and labor as it's a natural function and watching the situation and only jumping in when an actual situation emerges. So one is thinking there may be a situation emerging and we're going to act on that. The other is saying we're not going to act on it until a situation does emerge. So they're just two different philosophies. And it's important for you, the pregnant woman, to think, what am I most comfortable with? What do I want my care provider to do? So that's the first thing you want to make sure is that who you choose has the same birth philosophy as you. Now that said, because I even said midwifery model of care doesn't mean that OBGYNs don't practice that way. In fact, I know many wonderful OBs that still actually look at situations and say, I'm going to watch before I act. So the thing is, you don't want to just judge, oh, all OBs have this particular model, the medical model, and all midwives have this other one. You really want to have a conversation with your care provider ahead of time. All right, so what else should you check in with? You want to find out how aggressively does your care provider manage your care? And what do I mean by that? So are you a low-risk woman? And if you are, do you need intermittent monitoring or do you need full-time fetal monitoring? Can you eat or drink during your labor? Will your care provider allow you to try different positions to birth in, or are you going to only be on your back? Some care providers say you can push for however you want, but when the baby's actually coming out, I want to be able to see you from your back. And others are going to say, as long as I have some sort of view. So if you're thinking you want to have a few more options, you want to find that out ahead of time. You also want to find out, are you going to have mandatory IV fluids or are you just going to have a HEP block? So some of these things of how actively, how aggressively are they going to manage your care. Let's also talk about what kind of schedule you can expect. And again, I think this is a really important thing to talk about ahead of time because it's not fair for you to try to change the way your care provider practices, but you can change the practice in which you see. So if your care provider has very strict schedule rules and that's not what you want, it's important to recognize that and again, perhaps change practices. So what are some examples of schedule? How long can you labor before having augmentation, Pitocin? How long can you labor with Pitocin before they say failure to progress? How long can you labor with your water broken? That's one that a lot of women don't realize because only about 10% of women have what's called premature rupture of membrane. So even though in the movies it all comes off as like, oh, my water broke, that's the start of labor. That's not actually how it happens for the majority of women. So if your water did break and you check that it's clear and you don't have meconium, and all is going well, you can still feel baby, how long are you going to have the opportunity to labor at home before you have to go into the hospital setting? How long past your due date can you go? This also varies. Some care providers are going to say 1 day past your due date. Others are going to say you can go all the way to 41 weeks and 6 days. There's a lot of space there that you should know about ahead of time. And then how long can you labor at home? Different care providers have different rules. So if you're a VBAC, vaginal birth after cesarean, they may want you in a little bit earlier. But if you're your average low-risk woman and you want labor to kind of be going before you get to the hospital, there's different rules. Some care providers are going to say they want what's called a 4-1-1 rule, which means that the contractions are 4 minutes apart. Each contraction is lasting a full minute, and that pattern has been established for an hour. 4 minutes apart, 1 minute contractions, 1 hour of showing that pattern. Others are going to say 3-1-1, others are going to say 5-1-1. So again, how long can you labor at home? And then how long can you push? So some hospitals have protocols, 3 hours, that's it. Other care providers I've seen have watched the woman. They're saying she's doing fine, baby's doing fine. We're gonna allow this mother to work with her body, work with her baby, work with her contractions, and keep going. So those are just some schedule ideas. And it's helpful just to have this in mind so that, again, when you're going into the birth situation, you're not trying to negotiate any of this. I also think it's important to look at your practice's statistics. And by that I mean if they're high risk or low risk. If you're a low risk woman, maybe you don't need to be with a high risk practice. What is their cesarean rate? What is their intervention rate? What is their episiotomy rate? What is their instrumental birth rate, meaning forceps or vacuum? And again, what if it's a low risk, high risk? Should you be there? What are their statistics on that? And then lastly, when does the doctor show up? And that might sound crazy, like, of course my doctor is going to be there. But some practices are pretty small and they have hours during the day that they're seeing their other patients. So if you're with a sole practitioner or a small practice, they may not want to cancel all the appointments and run to the hospital if things are not quite moving. And so you likely will be seeing a resident until they show up. So just for your peace of mind, find out when the doctor's planning on showing up, or the midwife. So those are the 5 questions to ask before your birth. What is your birth philosophy? How aggressively will they manage your care? What is the schedule? What are their birth statistics? And when will they show up? So I hope you enjoyed that, and I hope it was insightful, and it will help you pick the care provider that is best for you. Have a wonderful night, and happy birthing.